Did you lose your tooth? I'm just kidding with you. So, welcome to another episode of You Can't Handle the Tooth. This is Dr. J, the real Floss Boss. I'm glad to be with you today for another episode of Facebook Live show we've been doing now for several months. I want to thank you, as always, for all of the views that we've been getting. Last week's video had almost 3,000, and that's not bad. That's pretty good. So really appreciate it. Had people, several suggestions this week on things we can do, a subject matter that we can cover. I keep getting the same question often, and so I wanted to sort of I had it twice today, and every day I get somebody that has this question, and it is if you have a tooth that you have lost. That's my joke. I was looking for a tooth. If you have a tooth that you've lost, what can you do to replace it? And I don't mean like a teenage trauma. That's not what this subject is on, like at a soccer field where you get an elbow or basketball and you lose a tooth. Not that. I'm talking about you've got a history of a tooth that had a fracture in it. It's got an old amalgam on it. Now the tooth is broken and it needs to be replaced. You had a root canal on a tooth that has gone bad. And now the tooth has to be replaced. You know, what do you do? So this is something that is really frustrating to me as a dentist, okay? If you have pain in your lower right abdomen and you have a fever and you go to the ER and they run some blood work and your white cell count is high, the chances are 50 out of, and all the blood work comes back in a certain way, the chances are 50 out of 50 doctors are going to say appendicitis. Okay, lower right pain, white cell count is high, feeling really sick. I mean, that's just the way it is. 50 out of 50. My grandmother, who I loved her. She loved to send me letters, especially ones that had negative things in them. So like. When I went into dental school, she would send me clippings of, crazy things that dentists have done over the years. And one of the things, though, I thought was very, very interesting. And they had one person that had the same oral condition went to a dentist in one of all the 50 states. So they'd go in as a new patient and they would get diagnosed with things to get done. And guess how many treatment plans they came back with? 50 different treatment plans. You're like, how can that be? You have a pain in your abdomen, 50 docs are going to say it's an appendicitis. But if you have dental conditions, you could potentially you go see 50 dentists, you could have 50 different treatment plans. That frustrates me to no end because I know it frustrates patients. They'll come in to me for a second opinion and I'll tell them, I think this would be a good idea. And they're like, oh man, the other dentist told me I should do something else. How do you know what is good and what is trustworthy information that you're getting, knowing those facts? Well, the variables are, A, you have a dentist's frame of mind. Some of them just want stable and steady. Others have a more cosmetic twist in their emphasis. Implants, for example, is something in dentistry that started really flourishing in the late 80s and 90s. Okay, so if you were a dentist that was practicing in the 70s and the 80s, you had little to no exposure whatsoever with implants. Yet now, if you're in dental school at MUSC, when you graduate, sometimes you have already placed an implant. So the approach to getting a mouth stable can be different, but the end result is hopefully the same, and that is to help a patient be able to eat whatever they want, whenever they want, for the rest of their life. That's the goal, okay? So when you say, I'm going to lose a tooth, how do you replace it? Guess what? There are several ways to replace it. Now, some dentists they're good with partials and dentures, and others, they really like bridges, and others, they really like implants. But there are some data for this stuff, okay? There are some things that you should know. If you lose a tooth, they've done studies on this that show which one of these tooth replacement options feels most like your own tooth. Okay? So, the number one is an implant. that's going to feel like it's your own tooth the most. And it came back to like 98%. That's what people feel like. When you talk about bridge work, doing 2 crowns and a fake tooth in the middle, that number comes back to around 70 to 80%. And when you start getting into partials that come in and out to replace teeth, the number drops well below 50%. They just don't feel like your own teeth. Do they work? Yes. Can you eat whatever you want whenever you want? Yes. But do they feel like they were born there? They feel natural, like they're your teeth, okay? Those are the big differences. So here are the options. If you have lost a tooth or you think you're going to lose a tooth and you're wondering what is the best option for me? A, what are you eligible for, right? That's a big deal. So let's say I'm missing teeth. I have my teeth to this canine and I have no teeth behind it. Well, I can't do a bridge because there's no tooth to anchor on the back, right? There's no teeth back there. If you have 2 teeth and a missing section, you may be eligible for a bridge. Are you eligible for an implant? Well, usually if you don't have any surgical complications, and I don't mean intraoperative surgical complications. I mean, do you have any preoperative complications? Do you have any blood issues, clotting issues that could prevent you from accepting an implant, prevent your body? Do you have any issues with your bone density problems? Are you on any bone medications? I mean, there are several criteria that could preclude anyone from being eligible for an implant. I mean, that's just it. So are you eligible for an implant? That's the question. Are you eligible for a bridge? Are you eligible for a partial? And what would preclude you from being eligible for a partial? Well, what if the remaining teeth you have are weak? See, if I have 4 teeth on the bottom and I'm going to put a partial of 10 more teeth down there, those 10 teeth are going to be functioning with the strength of only 4. Which puts a lot of pressure on these 4 remaining roots. And so it may not be the best option for you. Okay, so that's the kind of thing you have to start thinking. It's like, first of all, what do I want? But what am I eligible for? And that's what your dentist can talk to you about and can help you sort of, iron out those details. Of course, there's always a money issue. The implants are more expensive. The bridges are a little less expensive. And partials are usually half price or even less than half price. Okay, so that's something to think about. So when you've got a tooth that you're going to lose, long term, just start thinking, what do I want my smile to look like? What do I want my ability to eat to be like when I'm 70, when I'm 80 years old? Okay? That is going to help you in the decision process on what type of restoration to get. All right, the implants, let's talk about length. What lasts longer? The studies go like this. If you take 10 people who all are missing 1 tooth, and you place 1 implant in each of those 10 people, at the end of 10 years, you'll have about 9.6, 9.8 of those implants in place. Pretty good, right? If you do a bridge on those same 10 people instead of the implant, you'll have about 7.6% of those people will still have that bridge 10 years. So that's still a good solution. Bridges don't come out either, so they do feel, they feel like they're your teeth. And then the partial, those can last anywhere between 5, 10 years and even more. They're very unpredictable because there are different types of partials, and maybe that's a good subject for another video, is to talk about the types of partials and which one may be best for you if that's what you've decided that you want to do. So what about maintenance on on an implant? If you have a standalone implant with a standalone crown, the maintenance is just like it is for any other tooth. So you brush it, you floss it, you get x-rays on it, like normal teeth periodically. And it's like I say, it's just like it's your tooth. So what about a bridge? What's maintenance on it? Well, this was a suggestion from my friend Adam. And so Adam, a shout out to you, but this is a maintenance for a bridge. If you have a bridge, it does require a little more maintenance. And so what that means is you don't just floss through it like normal. Of course, you have to floss on the back and the front of it, but where that fake tooth is, you need to get a little floss threader, which is a little stiff floss, and you feed it through underneath the bridge. You take your floss and you go under there and you clean really good. Of course, you brush it like normal, okay? And you also get x-rays on it like normal, so the dentist can see if there's anything going on around the edges, if you're getting any decay under it and stuff like that. So that's how you clean them. A water pick is good, but a water pick is good for all teeth. I get patients, I'll ask them, I'll say, hey, how are you doing at flossing? Oh, well, I bought a water pick. Well, that's really good, but it's not as good as flossing. Anything's better than nothing, but flossing is what really gets the plaque out of there and keeps things clean, keeps your gums healthy. All right, and then for partial maintenance, you take those out every night and you just brush them, and that's it. So it's pretty easy to keep clean on those. All right, so we talked about the maintenance on them. Those are basically the options if you have a missing tooth. So there are, if you're missing more than one tooth, then the options get even greater. So I really wish it was a world where everyone could get an implant, everyone could afford an implant. And so when a patient comes in and they have a missing tooth, we're like, well, implant. Just like the appendicitis. Oh, appendectomy. I wish it were that easy. Unfortunately, it isn't. So there are lots of details to go over with an implant. There's some healing time. There's bone grafting possibilities. With a bridge, sometimes there's other fillings that have to go on those side teeth in addition to the bridge. So there's a lot. That's why having a good, healthy consult with your dentist is very, very important before you proceed. So you know everything that's going to be done. Make sure there's no hidden costs. Insurance is great, but it doesn't cover everything. So there's still some out-of-pocket money that you have to spend on all of these procedures. So if you need a second opinion, I think most dentists would want you to get one. All right, so I do. If a patient comes in and they want to get an implant, and I tell them what it all entails, and they're like, I'm not real sure I want to do it. Or sometimes they'll even call up and they'll say, hey, can I get an x-ray? I'd like to get a second opinion. I'm like, here's an x-ray. Here's 4 of the pictures we took. I want you to have all the information you need to go to see another dentist so they can help educate you as well, so you feel more comfortable about the decision that you're making. All right? So that is the discussion. Missing tooth. They are replaceable. It is fixable. And it can feel just like the teeth that you were born with. Just know that. It is restorable. All right? And that is what we're talking about today. Thanks a lot, Adam, for the tip. Looking forward to beating you on the tennis court this week. This is Dr. J, the Real Floss Boss. Please hit me up on Instagram. I get messages from Snapchat. I had a couple this week even. One from Saudi Arabia. I can't remember where the other one was from, but it's shocking because it comes from around the world. So anyway, please keep the questions coming. Otherwise, I'm just going to go to my database of questions that I get every day from live patients and from the phone calls. All right? So this is Dr. J, the Real Floss Boss, signing out. I will see you next week.